They say lung cancer is no more only a smoker's disease. How much of it do you think is true?
Smoking does increase the risk of cancer. It's not that every smoker gets lung cancer. Also true that not every non-smoker is safe from lung cancer.
Is air pollution and PM 2.5 becoming as dangerous as smoking for lung health?
There is no proof of it, but yes, the cells keep getting irritated and at some point they can shift from being normal to becoming cancerous.
Okay. Can quitting tobacco still reduce lung cancer risk even after years of smoking?
It requires 2 to 3 decades and depends on the age of the person, how much they can regenerate the normal lung also.
What is the biggest myth people still believe about smoking, pollution and lung cancer?
All of us need to understand that smoking does increase your risk of lung cancer, period. It's not a myth, it's proven.
Hey everyone, I'm Aishwarya and today I have with me Dr. Sai Vivek, Consultant Medical Oncologist, Aster Hospital, Bengaluru. He's here with us to talk about one of the most discussed topics, lung cancer. Let's get started. Welcome, sir. They say lung cancer is no more only a smoker's disease. How much of it do you think is true?
No, it is very true. I think if you're looking at 100 people with lung cancer, we are seeing that only around 60 to 70% actually have a history of smoking, and that too for long term. The rest 30 to 40%, we are seeing lung cancers in never smokers. I mean people who have never touched a cigarette.
Okay.
So yes, smoking does increase the risk of cancer. It's not that every smoker gets lung cancer. Also true that not every non-smoker is safe from lung cancer.
What do you think are the other factors making this happen?
We only know of certain risk factors which have never been proven, probably the air pollution.
So apart from smoking, what do you think are the other factors causing this?
I think environmental conditions, especially pollution, passive smoking. I think that's something very few people know about. You need not smoke directly, but if you're around people who smoke constantly, that itself can become a risk factor for lung cancer. Again, like with many other cancers, I think obesity, lack of physical activity, poor nutrition do play a risk, but we cannot conclusively say that yes, it can lead to lung cancer.
Okay. Is air pollution and PM 2.5 becoming as dangerous as smoking for lung health?
There is no proof of it, but yes, definitely anything which chronically irritates our respiratory cells can lead to cancer in the future. So it need not be one particular thing.
Okay.
So the cells keep getting irritated and at some point they can shift from being normal to becoming cancerous.
Why are non-smokers increasingly being diagnosed with lung cancer today?
So these are random events which happen in the genes or in their DNA. If we are talking about, let's say, 1 lakh population, around 8 to 10 people in that 1 lakh population in their normal life tend to develop random errors in their DNA. Okay. And those random errors are the ones which are causing cancers in such never smokers.
Okay. Can long-term exposure to pollution quietly damage the lungs for years?
Yes, of course, yes. I think as we just spoke about it, not only cancer, I think such exposure to irritant substances can cause other lung problems also, like chronic obstructive pulmonary disease and something known as interstitial disease, where the lungs become weaker progressively.
Okay. Does wearing a mask really help protect against pollution-related lung damage?
Again, that's a question where it depends upon what type of mask, how much is it able to filter. So over the counter, the available masks, we really don't have data to say that can actually help us prevent lung conditions.
Okay.
If best, trying to avoid it as much as possible, and where you can't, wearing the appropriate mask. Imagine you're working in a factory with a lot of pollution, just a simple mask will not do the trick.
If you were to suggest some precautions, what would they be?
I think it depends upon the safety regulations of that particular company. They would have different types of filters in the mask, which are recommended based on the environment you're in. And it's more of, I think, a state initiative that has to come in terms of reducing the general pollution of a particular city or a country. It cannot be an individualized decision, I feel.
Okay. Why do many people ignore early symptoms like persistent cough or breathlessness?
We are so tuned to the fact that simple respiratory illnesses like the flu or some bacterial infections can come and they can cause your cough and some amount of breathlessness, and we are going to the doctor who's nearby, taking the antibiotics. All that is fine. But the red flag here is when things don't go down or they persist for more than 2 to 3 weeks. I think that we need to educate people is a red flag. That is when you need to get an imaging or a CT scan, and that can pick up cancer in its early stage. Besides that, some cancers tend to mimic even chronic infection. So I think in India, which is the TB capital, we can say around 30% of the people are misdiagnosed, are having tuberculosis, and they're on treatment, and then eventually the cancer diagnosis comes up. So awareness is the problem there.
So I think a mere cough should not be considered something basic,
Yeah,
right? We
no.
should not ignore the...
Yes.
Ignore
While
the-
taking the symptomatic treatment at the family physician level, remembering that, okay, something is going beyond 2 weeks, okay, something needs to light up and say, you need to get another investigation done to make sure it's nothing more serious.
Is passive smoking still a major hidden cause of lung cancer in families?
Yes. It is a major factor in terms of, I would say in certain circumstances, it can be worse than smoking itself.
Exactly.
If you're around 2-3 people who are smoking all the time, your exposure might be more than them collectively.
So they say it's worse
It's
than...
worse, absolutely,
direct
yes.
Smoking. Okay. Can quitting tobacco still reduce lung cancer risk even after years of smoking?
I think it takes nearly a decade of, quitting for your risk to start coming down, and 2 to 3 decades for you to have the normal risk, or rather the risk as a normal individual who has never smoked. So it's not that you quit today and within 6 months you're fine. It requires 2 to 3 decades and depends on the age of the person, how much they can regenerate the normal lung also.
Okay. Who are at risk of lung cancer and any preventive test?
I think chronic smokers who have smoked more than a pack for 20 to 30 years can be one factor that we can consider. They can go for something known as low-dose CT screening.
Okay.
So once a year, it's a low-dose CT is a version of CT where your exposure to radiation is also lesser, and then we can pick up these early tumors. So you can't avoid a cancer, but when you pick it up in the early stages like stage 1 and 2, your cure rates go up to 90 to 95%.
Great.
So that way, screening and early diagnosis makes a huge difference.
Okay. Has immunotherapy changed hope and survival in advanced lung cancer?
That's a very good question, and nowadays immunotherapy has changed the outcomes not only in advanced, we are having immunotherapy in early lung cancers, in locally advanced lung cancers, and also in advanced lung cancers. So the thing with immunotherapy is we do have a subset of patients. Let's say we are using it for 100 patients at a time. There are around 30 to 40 patients in whom immunotherapy would control the disease for years together. Okay. So we have people going on for 3 years, 4 years with absolutely no symptoms and a very good control of disease. So that is the reason why you're seeing more and more people doing well on immunotherapy, because you're harnessing the power of the person's immunity to educate it about a foreign cell or a cancer cell, and that particular immunity is going to be under surveillance for development of more number of cells. So the benefits are slightly more long term with immunotherapy.
What are the early signs or symptoms that one needs to be aware of when it comes to detecting lung cancer?
So the typical symptoms are cough, which is unrelenting, chest pain, progressive breathlessness. So these are specific to the cancer per se in the lung. Also change in voice is one more thing I would add. But apart from this, any cancer in the body can have some constitutive symptoms. Okay. So loss of appetite, increasing fatigability, weight loss. So these are some things again that we should take into consideration along with the symptoms related to that organ.
How do you think AI has impacted the space?
So I think AI is making the life of a radiologist easier. So when they're looking at multiple CTs and X-rays in a particular day, it can guide them to look at one particular foci in that X-ray or a CT and trying to reduce the time they take to report one. So that's where I think it's going to make a big difference, not replace the radiologist, but make their life easier and make them do more effective work.
So if you were to walk us through the steps involved in the treatment, what would they be?
Like with any other cancer, first thing would be to assess what stage we are dealing with. So we have stage 1, 2, 3, 4. For stage 1, 2 and 3, surgery plays a big role. Okay. So before surgery, we do tend to give some amount of immunotherapy and chemotherapy followed by surgery. For stage 3B, 3C and 4, it's mainly either chemotherapy and immunotherapy, or there are a subset of around 30 to 40%, especially the women, non-smokers and younger individuals, where we pick up this DNA mutation that we were talking about.
Okay.
Those people can benefit from a pill also, like a targeted therapy which comes in the form of a pill.
Okay.
And they can take that pill for years together with good disease control. So stage 4, predominantly chemo, immuno or targeted therapy. Stage 1, 2, 3, it will be surgery, radiation, chemo, immuno or targeted therapy.
Okay.
So to simplify it, it's a multimodality treatment, depends
Okay.
on the stage, depends on the cause of the cancer. So there will be some amount of surgical intervention, radiation and medical. So these are 3 pillars on which the treatment goes about.
Okay. What is the biggest myth people still believe about smoking, pollution and lung cancer?
I think we are past that myth stage when it comes to smoking and lung cancer. All of us need to understand that smoking does increase your risk of lung cancer, period. It's not a myth, it's proven. One more thing is, the biggest myth that we need to bust is there are people who say, I've never touched a cigarette, so I'm going to ignore my symptoms of the lung. So that is where I think education needs to go, that never smokers also can develop lung cancer. Please do not ignore the red flags that we just discussed and consult your pulmonologist or an oncologist just to rule out the lung cancer, and the rest of the treatments can be easily done.
Does genetics play a role in this?
See, genetics has to be looked at in 2 fronts. One, has the DNA or genetic change happened in a person's lifetime? Those are the non-hereditary conditions. So lung cancer is mainly non-hereditary.
Okay.
So it's not that you have received the gene from your parents, you have developed a random change in your gene in your lifetime.
Okay.
So it's not a hereditary condition, if that's what you're referring
Yes,
to.
yes, that's what I was asking. Has immunotherapy changed hope and survival in advanced lung cancer?
Yes, for a good subset of patients, I would say around 30 to 40%, it has nearly doubled their survival compared to what it was pre-immunotherapy.
Okay. Any final message to our viewers, sir?
So I think any form of tobacco, I think, is not good for the body. I think especially the smoked version does increase your risk of risk of lung cancer. I think being aware of that particular fact and meeting your doctor when symptoms of lung cancer are seen in you is the most important thing, because early diagnosis has much better survival than advanced stages.
Thank you so much, doctor, for sharing your valuable insights.
Thank you.
And also helping us understand how immunotherapy is impacting the future of cancer care. And to all of you listening, stay informed, stay hopeful and stay healthy.